It's Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Farrett. President Trump and Republicans in Congress are floating plans for a substantial cut in the federal health program Medicaid. Republican supporters say that work requirements and other changes would save money while making sure Medicaid still helps the people who need it the most.
The Congressional Budget Office estimates that budget changes in the main bill before Congress would lead to more than 10 million people losing Medicaid coverage nationwide over the next decade. The budget also includes the elimination of federal grants for rural hospitals and rural health care programs.
A rural health care organization in Wisconsin says those changes would be devastating for Wisconsin's rural hospitals. John Ike is director of the Wisconsin Office of Rural Health. John, thanks for joining us today.
Oh, my pleasure. Thanks for asking me.
Wisconsin has 76 rural hospitals statewide. What do they have at stake as we watch for what comes out of this budget on Medicaid?
Well, I think politicians will often focus on the people receiving the Medicaid, people in need of health care, as somehow not deserving it. But I think we have to realize that it is not only them, 1/3 of children in rural areas, 14% of seniors, et cetera. But we have to realize that those payments actually go to support rural hospitals, EMS, rural clinics, providers, et cetera. So it's a devastating blow to the healthcare industry as well. And as far as the work requirements, I'm curious how they're going to enact that with, like I said, 1 out of 3 rural children in the state of Wisconsin being on Medicaid, and these 14% of rural seniors. I'm not sure how that looks.
How much, when it comes to a hospital's budget, a rural hospital's budget, how much of that depends on patients who come in and are relying on Medicaid to cover those bills?
Well, I can't give you an exact figure, but I can say that when patients desperately need care, maybe they've had a car accident on the side of the road, they've had a heart attack or stroke or seizure in their home, the hospital's duty is to provide care regardless of ability to pay. And so if someone does not have coverage, whether through private insurance or Medicaid, Medicare, then the hospital has to eat those costs. And that makes it expensive, more expensive for everyone else, and can threaten that hospital's sustainability, viability. In fact, one of the ways that hospitals work very hard to try and make sure that if someone is eligible for Medicaid, that they are signed up for it. So removing more of those patients, more of that coverage, is going to be a very difficult blow for rural hospitals, clinics, and EMS.
When we think of Medicaid, we think of, as you mentioned, the support that goes to individual recipients, and then they use that to get their health care. Grants are also part of Medicaid, and I understand there are some that affect rural Wisconsin that are on the chopping block, in effect. What kind of things do you have your eyes on?
Well, so what we're saying is, and these grants don't necessarily come from Medicaid. They come from all of the Health and Human Services federal agency. And what we're seeing is, first of all, there was a leaked memo from the Trump administration saying they were going to specifically eliminate 3 out of the 4 programs in our office. So this is $2 million worth of funding for rural healthcare that comes every year into Wisconsin. And so then that was quiet. We've looked to Congress. They've had very strong support in the bipartisan fashion for these programs that help improve access to care, quality of care, improve patient outcomes around the state, help rural hospitals struggling with their bottom line. So again, $2 million a year that is under threat. Congress, who has the power of the purse, has been a strong supporter. However, what we're realizing recently is that Health and Human Services is slow walking the approvals for the grants that are happening on an annual basis. So while it may not say directly, we are closing your program, sort of like they did to AmeriCorps or USAID, what could be happening is that the grants will just never get approved, and therefore in our office we're going to have to lay off staff. These programs are going to close their contracts and services to rural hospitals, to our partners in the like hospital association, et cetera, are going to need to be defaulted on. Um, it's not a happy prospect for our state.
John Ike is with us, director of the Wisconsin Office of Rural Health, looking at proposed cuts to Medicaid and other rural health care funding and what they'd mean here in Wisconsin. John, in a letter to Wisconsin's rural hospitals recently, you wrote that Wisconsin's rural healthcare landscape has relied a lot on federal funding when compared, for example, to other states. How dependent are rural Wisconsin hospitals and other health programs on federal Medicaid funding as opposed to state?
Well, I think it makes sense for state legislators when they look and see that the federal government is providing these kind of grants for these services to say, well, the federal government is handling this. We don't have to. The state does support things like loan repayment. It matches funds from the federal government, et cetera. But unfortunately, that leaves us really unbalanced. So I would say that about 80 to 90% of our funding is federal in nature. Um, and so if something happens to federal funding, like I said, that puts us at risk of closure, and it puts those services and those that funding that gets passed through to rural hospitals um, at real jeopardy.
We've seen already in Wisconsin a couple of hospitals in the western part of the state and their affiliated health systems have to close down. Are you concerned that these cuts would lead to more outright closures or substantial service cuts at our rural hospitals?
I am, in public analysis of the financial outcomes for rural hospitals in Wisconsin, 10 of them are operating in a negative margin as of the first of 2024. That's the last time we have the best data for it. Um, and there are, I think, about 4 or 5 others that are below national standards for that. And so every entity, every organization can have a bad year. They can turn that around. But if someone is on the bubble like that, where they're just riding that fence, striving to get back up into the black, to lose Medicaid coverage, to lose the support from programs like our office, can be the factor that causes that facility to close.
I want to talk about a healthcare consumer in a rural part of the state, whether they're on Medicaid or not. How accessible is healthcare in rural parts of the state? How much further might people have to travel to get different kinds of healthcare if we see some of those hospitals you were just talking about not be able to keep the doors open?
Yes, well, it really depends what part of the state you're in. We have some large forests and parks that with lower population in the north, so you tend to see fewer healthcare facilities and ambulance services, et cetera, in them. And so losing one of those, there are counties in our state where there is only one hospital in the county. Clearly, if that closes, that's going to be an incredible hardship on that county and those residents, and those in neighboring counties that went to it because it was closer. Um, I feel like in our state, we've done actually a great job with many parties involved in ensuring that there is proper access. But these kind of threats really put that system at risk.
Now, your office, the State Office of Rural Health, also faces funding threats here. What kind of services are you providing now? How long can you commit to keep doing that given the budget uncertainty at this point?
Well, unfortunately, we're sort of between a rock and a hard place. Imagine our office or programs like us, across the state and nation, is we're a car and we're given a year's worth of gas. And so we drive for a year, and then usually we stop at our federal gas station at the end of the year. They fill us up for another year, and we keep going. If that gas station is shuttered, then our car stops right there. So we have one grant that is ending May 31st. We don't have a notice of award from the federal government yet. So as of June 1st, we have to stop working on that grant. The hospitals that were going to receive money from that grant will not. July 1st, we have another big one. And then September 1st, we have our final. Those three, if we do not receive a notice of award, we don't have a bridge. We can't really coast. at that point, we have to lay off staff and shutter the programs.
You mentioned the reliance on federal funding. If those grants don't come through, if the Medicaid funding is cut, do you have any hope that in our budget situation now in Wisconsin, there could be backfill, that the state would step up and meet at least some of these things that are being cut?
I would hope so. I would love to see. I think this is an opportunity for the state of Wisconsin to look at this and say, hey, you know what, for our citizens, for our residents in all parts of the state, we need to make sure that we are providing the resources they need, because sometimes the federal government is not as dependable in these areas. So I think that's a real opportunity. Even if there is backfill, I'm not sure. It's a really interesting, sort of insidious plan. If you don't fund an organization for a couple of months, then there is no longer staff. There is no longer an office because the rent can't be paid. You can't just pour water on that plant and have it spring back to life. The plant has died. And so while those funds may, I expect Congress to be sort of outraged that they had appropriated the money for these programs and then the administration had not implemented them. If I was a federal legislator, that would annoy me. So I expect there to be some pushback, but my worry is that there just won't be an Office of Rural Health to fund again.
John, we'll leave it there. Thanks again for joining us.
Thank you very much for the questions.
That's John Ike, director of the Wisconsin Office of Rural Health. He talked to us about proposed Medicaid cuts and other federal programs that affect rural health care, what they can mean for care in rural parts of the state. If you live in rural Wisconsin, are you worried about this? Do you already have long drives to get needed health care? Are you worried about what might happen if your local hospital or healthcare system has to close? Tell us about it. Email wisconsintoday@wpr.org. That's wisconsintoday@wpr.org.
Coming up, the end of Roe versus Wade didn't end the abortion debate. Find out how the legal concept of fetal personhood could shape the issue in Wisconsin and beyond.
We're in that kind of moment where we have a lot of these statements on the books, and we don't know how seriously courts or prosecutors are going to take them or how they're going to interpret them.
That's next here on WPR News. It's Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Farrett. The Dobbs decision at the U.S. Supreme Court in 2022 overturned Roe v. Wade and started a new chapter in the legal dispute over abortion. It was a big change at the national and state levels.
But that wasn't the end of the road for groups opposed to abortion. A new book tells the story of a wider goal, that is the effort to establish legal fetal personhood, starting at the moment of conception.
About a third of states, including Wisconsin, have at least one law that refers to fetuses as people, though the laws vary enormously from state to state.
Abortion scholar Mary Ziegler is with us for a look at the decades-long legal argument over fetal personhood and what it means for Wisconsin.
Mary Ziegler is the Martin Luther King Jr. Professor of Law at the University of California, Davis, the author of a lot of books on the history of the abortion debate in the U.S. Her newest book is Personhood, the New Civil War Over Reproduction. Mary, welcome to Wisconsin Today.
Thanks for having me.
Well, I think there may have been an impression out there that the end of Roe v. Wade with the Dobbs decision was in some ways the end of the story. It wasn't. It was the start of a new chapter. And as you write, this idea of fetal personhood is still driving a lot of the activism, especially on the pro-life, anti-abortion side. What do we mean by fetal personhood?
So there are lots of ways you could mean that personhood or life begins at a certain point in pregnancy, but what I mean is really a claim about the law. In particular, the claim that the word person in the 14th Amendment, which gives us due process and equality, applies the moment an egg is fertilized. So this is a claim about our Constitution and about our rights, not just a claim about when human life begins.
you track decades of activism related to the abortion issue. Now, post Dobbs, is this idea, this legal idea of fetal personhood, driving a lot of what we're seeing from groups opposed to abortion?
Absolutely. So this idea of fetal personhood was always sort of the end game for abortion opponents. It wasn't to let each state make its own decision. And it isn't something I think that most pro-life or anti-abortion leaders think is going to succeed imminently. It's kind of the next big goal, right? So if you think of the past half century as being driven by the effort to get rid of Roe v. Wade, the next half century, I think, is going to be driving at this idea of fetal rights, even as we see other kind of pitched battles over things like abortion and IVF in the meantime.
Is it all or nothing? Is the idea that if there is a law or a Supreme Court ruling, say, that says, yes, fetal personhood, this applies from the moment of conception, this is a total game changer, or are there incremental steps that could happen, sort of between cases?
Yeah, the end goal is probably a Supreme Court's decision saying that there are constitutional fetal rights, and abortion opponents assume that if that's true, it would be not allowed essentially for states to have more liberal policies on abortion or IVF, right? Even if that's what voters there wanted. That's not necessarily where the strategy is heading immediately. So abortion opponents have devised ways to more incrementally recognize fetal rights in the near term. So we're seeing legislatures passing laws saying you can sue for wrongful death when you lose a pregnancy, mandating child support during pregnancy, lots of steps to say that life in the womb has some value or some rights, but that's all building, I think, toward the conclusion that those rights ought to be constitutional and that those constitutional fetal rights ought to override voters' abilities to set their own policy on things like abortion and IVF.
If full fetal personhood were recognized, whether it was a constitutional amendment or a Supreme Court ruling or whatever the case might be, and full rights reside from the moment of conception, that means that you could apply a homicide statute, for example, in a case of abortion. Do I have that right?
That's right. Well, one of the things that I think emerges when you start really seriously thinking about fetal personhood is that there's a lot of disagreement about what it would entail. And one of the real battles within the pro-life movement right now is whether or not recognizing fetal personhood would require abortion to be treated as homicide, both in the sense of how harshly it's punished and also in the sense of who is punished, right? So whether women would be punished for abortion as well as providers. And that's not something that's been resolved really within the movement. It's not clear how it would be resolved, right, with a court decision or a constitutional amendment. And we're just starting to see these battles play out publicly, right? Because before the Supreme Court overruled Roe v. Wade, all these concepts of personhood were just kind of abstract intellectual exercises. They were visions of the promised land for abortion opponents. So we're starting to see in the open many more of these conversations about who would have to be punished and why.
Now, just like Dobbs didn't end the abortion debate in the United States, the debate didn't begin with the Roe v. Wade decision. And you dig into some of that history. What are some of the first arguments in the modern abortion debate era we see coming out? The first people saying on the pro-life, anti-abortion side, we should be making the case for fetal personhood.
Well, there had been a movement in the 1960s to reform 19th century criminal abortion laws. And at the time, the anti-abortion or pro-life movement was predominantly Catholic, and the movement tried a lot of arguments that had been around for a while, like arguing that abortion wasn't necessary because pregnancy was no longer dangerous, or that legalizing abortion would lead to sexual promiscuity. But none of those arguments were really working. So instead, lawyers within the movement began proposing that voters just couldn't liberalize abortion laws because doing so would be unconstitutional. So at first, this was very much kind of like a strategic necessity, talking about fetal personhood. But what's fascinating is that once the arguments were out there, they really struck a chord with a lot of Americans who would identify as pro-life, and they continued to be kind of a touchstone for what the movement wanted to be and do over half a century, even when those arguments weren't politically expedient, even when they seemed completely unrealistic.
And it was interesting, you write, in the 60s, I think in particular, some of the pro-life movement was framed in a civil rights way, saying, hey, if we're looking to protect people based on race or gender, well, here's a group of people who are being discriminated against as well. And the coalition involved, in some cases, people who otherwise we might think of as on the left, who were involved in civil rights marches and also overlapped some with the pro-life movement. Can you talk about that and how it shook out?
Absolutely. In the 60s, almost everyone in the pro-life movement agreed that the unborn child was the ultimate victim of discrimination in America. And the movement at the time was a pretty broad coalition. So what that meant varied quite a bit. So there were some in the movement who were opposed to the civil rights movement, who meant by that the civil rights movement was illegitimate and was asking for special rights for people of color that weren't necessary. Other people were very sympathetic to the civil rights movement, did civil rights work themselves, but still saw abortion as a kind of uniquely pernicious form of discrimination. So there was still this kind of common denominator of saying, one, that unborn children are greater victims of discrimination than anyone else. And two, that meant we'd kind of fundamentally misunderstood what discrimination was. So there was definitely a pretty diverse coalition in terms of civil rights, but there was also a kind of agreement that civil rights at their core needed to be rethought.
Something that struck me reading the history you lay out, Mary, is I think on both sides, pro-choice, pro-life, there's a view of the other side as very cynical, politically minded, manipulative in some ways. And of course, they are both sides playing politics here. But at the heart of it, the people active on both sides of this issue, I think, are very sincere in their beliefs. The things they're saying do match their beliefs about the civil rights of fetuses or of women. Is that fair to say that these are not just cynical political movements?
I think that's absolutely right. And I think it actually would really behoove anyone who's passionate about this issue on either side to stop thinking of their opposition as cynical, because that's been, I think, a great handicap to both movements. If you are in the archives of either movement and you see how people talk to one another when there are no reporters in the room, there are no politicians in the room, there are no voters or judges in the room, they still sound just as committed to what they're saying oftentimes as they do when there is an audience. That doesn't mean, of course, that there aren't other deep beliefs about things like race or gender or motherhood or corporate power or whatever underneath the sincere beliefs. But I do think that if we really want to understand these conflicts in America, we have to understand that the people involved are almost, not always, but there's a kind of core of sincerity in both movements.
We're talking to law professor Mary Ziegler from the University of California, Davis, about her new book. It's called Personhood, The New Civil War Over Reproduction. I'd like to bring things here to Wisconsin a little bit, if I may, Mary. Now, Wisconsin, it shows up on a list of having laws that define in some way fetal personhood, but it's kind of a more obscure law, a law that says, hey, you can't use public funds from any level to subsidize abortions. And then in the process of that law, they say abortion means the intentional destruction of the life of an unborn child, and then defines unborn child starting at the time of conception. That's how it's laid out in that law. It doesn't define the laws of the whole state, though. How does a line like that in laws, is that like a slippery slope or a foot in the door kind of thing, or is it just sort of an afterthought?
Yeah, we don't know is one of the answers. So part of the history of struggles over fetal rights in the US is that for decades when Roe was on the books, a lot of states like Wisconsin passed laws that recognize some sort of fetal right. And it isn't just swing states like Wisconsin. I'm in California, which may be the kind of ultimate blue state, and there's fetal rights language and statutes in California too. So one of the kind of great questions coming after Dobbs is whether those laws will become enforceable. So to use one example, Alabama long had a law that said that, unborn children or fetuses were children for the purposes of wrongful death, but no one really figured out what that meant until the Alabama Supreme Court last year said something that suggested that in vitro fertilization in the state was functionally unworkable. So we're in that kind of moment where we have a lot of these statements on the books, and we don't know how seriously courts or prosecutors are going to take them or how they're going to interpret them. So there's a lot of uncertainty on that front in states like Wisconsin.
The idea of a legal definition of fetal personhood in the state, the full version here in Wisconsin, seems like a pretty unlikely scenario in the current makeup. Do you see a likely path forward for fetal personhood expansion here in a state like Wisconsin?
Not in the short term. So Wisconsin isn't going to be ground zero for fetal rights. If you're looking for what is, it's likely to be states with the most conservative state Supreme Courts, because legislatures, even in places much redder than Wisconsin, are aware of the fact that it would be a politically risky move. And that's particularly true in a place like Wisconsin, where partisan control flips back and forth. Where I think you may see fetal personhood show up in Wisconsin is in these kinds of more incremental proposals coming from the legislature. So you may see fetal rights written into other laws that are not involving abortion or IVF that pro-life forces elsewhere in the country may point to in making a case to the federal courts. Because there's a reason why the US Supreme Court is the destination a lot of pro-life folks have in mind. And that's because they're worried that they can't win with voters, so they have to rely on the federal judiciary instead. But I think in the near term, Wisconsin's much more likely to end up in the camp of states that recognize some sort of state constitutional right to abortion because of where the state Supreme Court is heading than it is anything else.
At the federal level, I think the assumption is that if something like fetal personhood were to come, it would probably be the U.S. Supreme Court. There have been efforts in Congress that you describe in your book over the years, but you also point out that some people, supporters of the incoming second Trump administration, have made a legal argument saying, hey, the president can do this. The president could say, the 14th Amendment should apply to life beginning at conception and instruct the Justice Department to go to states where abortion is legal and start taking action. This is not something that I've seen any action on yet from the Trump administration. What do you look at in the pro-life movement as they watch and wait and maybe hope for action like that from President Trump?
Trump has done some things to please the pro-life movement, but relatively speaking, he hasn't done much, right? A lot of the moves he's made look very similar to moves that Republicans made when Roe was on the books. But of course, he could do much more now that Roe is gone. So the most probably eventful thing that's happened recently is that Robert F. Kennedy Jr. just suggested before Congress that he opened an investigation into mifepristone, which is a drug that's now used in well over half of abortions in the US. It may lead to eventually more restrictions on the drug. But I think anti-abortion leaders are well aware that Trump is not in a big hurry to deliver on their priorities. And so a personhood executive order seems like a pipe dream when even something like imposing restrictions on mifepristone is hard to get the president to do.
And President Trump in the presidential campaign spoke very favorably of in vitro fertilization. One of his offers was to say he would make it free in the country. He spoke, said he would be friendly in some ways to reproductive rights. Again, looking at this from the vantage point of the pro-life movement, what do they make of that whipsaw in some cases?
Well, I think in vitro fertilization is becoming a very difficult issue for Republicans for just this reason. So you can see this in some ways in the way Republicans behave on the issue. On the one hand, praising IVF, on the other hand, often defeating or voting against bills like the Right to IVF Act. IVF, on the one hand, is tremendously popular, one of the things that you'll get the most glowing poll numbers on of anything you could ask Americans. On the other hand, it obviously, in some ways, is in tension with the idea of fetal personhood. If you believe embryos created through IVF are rights-holding persons, it's weird that people can store them. It's weird that people can dispose of them. It may even be weird that people can donate them to other couples in a way that wouldn't be considered an adoption with all the usual legal rigmarole and protections that come with adoption. So I think fetal personhood is in the background of Republicans both praising IVF, but also not really being sure exactly what to do about it. And that's, I think, especially true as the pro-life movements become more vocally opposed to IVF, and when critically important conservative Christian denominations like the Southern Baptist Convention have too.
As we wrap up, your book is out on personhood. The story obviously is not over. What are you watching for? What do you have your eyes on most closely now?
Well, I think in the short term, there are lots of things to follow. There are a couple of big issues unfolding in the courts. There's whether the Comstock Act and 19th century abortion and obscenity law is actually a backdoor ban on abortion. That's a case. There's a case on that before the courts. There's whether Trump pulls the trigger on some kind of national restriction on mifepristone. And then, of course, there's a possibility of a war between the states. Wisconsin at the moment is watching its own state Supreme Court resolve conflicts there. But I think people in Wisconsin are watching to see what happens as states start fighting one another. We're seeing red states trying to prosecute doctors in places where abortion rights are protected. So if Wisconsin becomes one of those states, it'll be interesting to see how those conflicts, the sort of civil war between the states, if you will, begins to be resolved in the years to come.
Mary, thanks again for joining us today.
Thanks for having me.
Mary Ziegler is professor of law at the University of California, Davis, and an expert on the history of the abortion debate in the U.S. She talked to us about her new book. It's called Personhood, The New Civil War Over Reproduction.
Still ahead, nearly 1,000 Wisconsin farmers respond to a survey gauging their thoughts on climate change and sustainability.
Sometimes we neglect to understand this, that farmers are very caring people. They care for the land, they care for their communities, and turns out this matters to them.
Findings on the future of Wisconsin agriculture. That's next from WPR News.
It's Wisconsin Today. I'm Rob Farrett.
And I'm Kate Archer-Kent. Living on a farm offers a profound connection to nature.
Farmers are outside every day. They learn the cadences of the natural world as they work to produce our country's food.
So, are Wisconsin farmers seeing the effects of climate change?
That's the question that Michael Bell, a UW-Madison environmental sociology professor, was trying to answer. He leads the Soil Health and Agroecological Living Lab.
Bell heard from almost 1,000 farmers around the state to learn how they think about climate change and sustainability. Michael, welcome to Wisconsin Today.
Thank you so much.
Also with us is Richard Cates, co-owner of Cates Family Farm. He wrote a book last year about his land ethic in the Driftless region, raising grass-fed beef while working to restore the land and the adjoining trout stream in Iowa County. Dick, welcome to you.
Oh, thank you very much. It's a pleasure to be here with you.
Michael, let's start with you. What were you trying to learn from this farmer survey you put out?
Well, we really wanted to get an understanding of the relationship between farmers' beliefs and what they're actually doing, both how what they're doing shapes their beliefs and how their beliefs shape what they're doing. And we had I think, in this polarized time, a happy discovery, which is that the majority of farmers in our survey were actually concerned that climate change is happening. And that's such a polarized issue these days. It was really nice to see that there is broad agreement on that issue.
So if a little more than half of the 942 farmers you heard from think that climate change is happening, did you think that percentage would be higher at this point? Or it seems like you're okay with that?
We were actually expecting it to be lower.
Huh.
It's a little lower than the national average of someone independent of their occupation. It's about 74% nationally, about 56%. Did I say 58 before? It's 56%. Is a pretty strong number, and especially when you're looking at an issue that literally 97% of climate scientists agree is underway.
Have you asked that question before?
No, this is the first survey that we've done. We're hoping to do this on a regular basis to get a feel of the pulse of our farm community here in Wisconsin.
Dick, how are you seeing climate change affect the land on your cattle farm?
I've been here for 58 years. And first of all, as a younger boy, of course, and my wife Kim and I took over the farm, and we started our own business here in 1987. And I really keep track of every time it floods here. I keep track of the rain, and I write notes about the temperatures. And the really the long and the short of it is, and I don't think there's really any uncertainty, is the winters we have less snow, we have more freezing and thawing, and the summers we just they're hotter with more humidity. Humidity is tougher on cattle, and although winters that are a little warmer are easier on cattle, it's the wet that occurs, the freezing, thawing, the mud, then the ice, that makes it challenging.
And Dick, I want to ask you about the soil because you hold a doctorate in soil science. How is the soil doing on your farm when you have these freeze, thaw cycles and more ups and downs with temperature?
The freezing and thawing doesn't hurt the soil as much as it can. It's harder on the plants because as the ground shrinks and swells, you get a separation between the plant crowns and the roots. Folks who garden know that garlic didn't do very well this year, and it's for that reason, is that the cloves heaved up and the roots stayed down. And it is hard on the soil if livestock are in one place for a long period of time because it compresses it. But that becomes an imperative for us. We move our livestock every day so that the hoof action is productive and not destructive. So that's how we do it. We pay attention to this very closely.
But other farms that have other forms of production are also doing other techniques to really help the soil and make the agriculture more sustainable. In our survey, we found that the average farmer in the state is using 4 different practices that are enhancing the sustainability of their operation. Some of them, like cover crops, 46% of farmers report that they're doing it. Manure application and crediting that, 58% are doing that. So these are really very significant numbers, but almost everyone is doing something. Only 5% of the respondents to our survey, of the 15 sustainable practices that we had in the survey, said they weren't doing any of them. So people are really working hard on this. They care, and that's so wonderful to hear and appreciate.
Michael, on the survey results, was there something that stood out to you? I mean, we know that there is widespread belief that climate change is happening, but is there anything else on the survey that kind of jumped off the page for you?
Well, there are political differences in this, and it's important not to neglect that, particularly in this increasingly polarized time. And it is true that folks who identify as Democrat on the survey are much more likely to be concerned and see climate change happening. But independent, Republican-leading, and Republican farmers as well are showing high levels of concern, higher than we anticipated, of Republicans are showing about 42% concern. Republican leaning is 55%. Independents, 62%. So, we're talking statistics here, but what this is showing is that we actually do agree on so much.
Why was it important to you to ask about political affiliation on this survey?
Well, climate change issues have been very politicized, and we were hoping to see the extent to which maybe it isn't as oppositional as so often we hear in the news media. And it turned out that's the case.
We're talking about a survey of Wisconsin farmers about how they view climate change. Michael Bell is here, UW-Madison environmental sociology professor, and Dick Cates, who co-owns Cates Family Farm in Iowa County in the southwest part of the state. Dick, in your new book, you write about how your family transitioned from seeing themselves as owners of a ranch to caretakers of the land and water where you raise your cattle. Can you explain that distinction and that mindset?
Oh, absolutely. For us, care of these gifts, we look at the soil and water, the wildlife, the forest, that we have the distinct opportunity and privilege to care for. We look at them as gifts, and yes, we pay taxes on this land, but we are here for a very short time. And when I was doing the research on my book, we learned of projectile points in the headwaters of our watershed that are 10,000 years ago. And folks have been traveling up and down our stream for that long. And that's a humbling thing. And we realized, they gave us something of value. They passed it on. And we felt that that was our obligation to, again, reciprocate or give those gifts back to the next generations. And we call it a land ethic, which is from Aldo Leopold's Sand County Almanac, which simply means it's an imperative to take personal care, personal responsibility for the resources or gifts that you're given. So that's been a major piece of our farming history. And our son and daughter-in-law, who took the farm over just 9 years ago, have really made it a tagline in their entire way of life. So it's a beautiful thing.
Their farm really is very beautiful. I had the good fortune to be out there actually just yesterday for a different reason. And I was joking with Dick when I got out of my car. The farm was so noisy. But what it was noisy with was birds. There were birds everywhere. Everybody was singing. It was just glorious.
Yeah, thank you, Mike.
The sound of sustainability, it's there on their farm.
So, Michael, did your survey find then that the caretaker attitude is quite common among farmers in Wisconsin?
Well, the attitude or the behavior. So in terms of the behavior, 95% of the farmers are doing something. In terms of the attitude, okay, if we're measuring it in terms of whether you think climate change is happening, whether you think it's human caused, things of that sort, those numbers are quite a bit lower. So, but let's emphasize that we do all care for the beauty of our state and how it'll go on to the next generation, just as is happening on the Cates family farm.
Dick, your farming can also mirror so many other farmers around you who have a conservation ethic. And there are federal changes afoot with conservation efforts that, have been supported by billions of dollars in federal funding that the Trump administration has now frozen. How do you think that will affect farmers' efforts to be good stewards of the land?
Well, it certainly will have an impact because some farmers expect a payment for a conservation activity. If I'm going to put a cover crop on, I want X number of dollars in return. But I think that in the bigger picture, what really motivates conservation attitude is having the right ethic, an ethic of care. And in our community here, when one farmer shows good stewardship and protects the soil, the next farmer sees that and says, I can do that. And then when the community begins to expect it, and I think this is a very important piece, when we get applauded or lauded for good practices, that lifts the boat. That lifts us all, and folks say, I can do a better job.
Michael, what motivates an ethic of care, and do conservation grants help?
Well, I think what motivates an ethic of care is connection with others. Not necessarily only human others, but also other creatures. So when you go out on the Cates family farm and you're surrounded by birds, just clouds of them, and insects everywhere, which the birds are eating, or if you go down to their class 1 trout stream and look at the fish there, those kinds of interactions with others, also with human others too, is what really gives us a basis of care. And so often these days, we are separated by so many structures of how life is organized. And it's so great when you see the potential for connection right there on your plate, and you're thinking about that food and where it came from in Wisconsin or elsewhere in the country, and the people that were involved in bringing it to your plate. And so those connections are possible, and I think if we start thinking more about that, we'll find that we love each other and the land even more.
Michael and Dick, thank you so much for joining us.
It's been a pleasure.
Oh, it's our pleasure. Thank you so much for caring.
Dick Cates is co-owner of Cates Family Farm. That's in Iowa County, and the author of A Creek Runs Through This Driftless Land, A Farm Family's Journey Toward a Land Ethic. And Michael Bell is an environmental sociology professor at UW-Madison. We learned about new research on farmers' attitudes toward climate change and how they affect Wisconsin.
A while back, we talked to a game store owner in Sheboygan about the social and emotional benefits of playing games, and we asked for your stories.
We got a text from a listener who says, I'm a 61-year-old who bonds with my adult sons and my friends, as well as my husband, over lots of different kinds of games. Not a fan of high strategy games, but really enjoy the social aspects and the mental stimulation of card games and board games. They make for an inexpensive evening at home entertaining.
How about you? Do you look forward to games of one sort or another with friends and or family? Tell us about it.
Email wisconsintoday@wpr.org or get in touch by voicemail or text at 888-642-0232. Once again, that's 888-642-0232 to talk about games.
Wisconsin Today producers include Trevor Hook, Colleen Leahy, and Joe Tarr.
Our technical directors are Sarah Hopeful and Tyler Ditter. Learn more about us at wpr.org/Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Ferrett. You're listening to WPR News.